You're listening to EduVoices, Champion Foster Futures, a podcast amplifying the voices of those transforming education for children in foster care. Each episode brings you real stories, research, and advocacy efforts to improve the lives of foster youth. Don't forget to subscribe on your favorite podcast platform so you never miss an episode. Now, let's dive in.
Welcome to EduVoices, Championing Foster Futures, a podcast dedicated to elevating conversations that matter for children, youth, families, and systems that support them. I'm Dr. Stephanie Barbary.
And I'm Dr. Dusty Palmer. We're glad you're joining us for this special 3-part series recorded with leaders from Texas CASA in Austin, Texas.
In this series, we explore foster care from multiple angles: leadership, family engagement, program support, and policy, to better understand how advocacy and collaboration can strengthen outcomes for foster-connected youth.
Each episode stands on its own, but together they offer a broader look at the people, practices, and policies shaping support across Texas.
In today's episode, we're honored to be joined by Vicki Spriggs, Chief Executive Officer of Texas CASA.
Vicki leads statewide efforts to support and strengthen CASA programs across Texas, working the intersection of advocacy, policy, and systems leadership to improve outcomes for children in foster care.
Her perspective gives us a powerful look at how large-scale coordination translates into local impact for foster-connected youth. We're excited to learn from her leadership. Let's get started. So can you describe Texas CASA's mission and vision for foster youth?
Sure. So our mission, we're a state membership organization of the 74 local CASA programs across the state. Each one of them is an independent 501c3, and collectively they serve 217 of the state's 254 counties. That's the program. The mission of CASA, generally, is to support volunteer advocacy for children in the state's child welfare system. And since the majority of those children are in foster care placements, then there you have it. Our goal or our vision for youth in the child welfare system is that they exit. The ideal situation would be going back home because the situation at home has been addressed and corrected. If that's not possible, then they're able to find permanency in another loving situation. That's our best dream for children in the state's foster care system.
I like how that vision is that reunification, first with the family. No, they're taken away, but no, that's our goal. Let's get them back with their parents.
Exactly.
Let's see what we do with that. Let's get more specific. How do you define Texas CASA's role in shaping outcomes for foster-connected youth across Texas?
Our role is to support our members by hearing their concerns and addressing our actions and our resources and activities to address their concerns, right? Because they're the ones, our local programs are the ones who are working with the volunteers at the local level. And those volunteers are working with children in the foster care system. So our role is to support them. When we find out what their concerns are, we adjust to address their concerns so that they're able to better equip their staff, because all volunteers have supervisors. So when we say volunteers, we're not talking about somebody who comes in off the street and then is given a child to advocate for. Volunteers are people, anyone from any walk of life in Texas who is interested in making a difference in Texas children finding permanency and who have been victims of abuse. That person can let their interest be known. They are trained by the local CASA program, and then they're background checked, sworn in, and then they're assigned a supervisor. When they're assigned a case, they're assigned a supervisor. So the volunteer is not doing it by themselves. So when I say we support the local program in supporting volunteer advocacy for the best outcome for these children in foster care, what I'm saying is we listen to what their concerns are, what their challenges are, and then our role is to respond and support them so that they can best supervise and support the volunteers as the volunteers advocate for these children.
Mm-hmm. Okay.
Long answer to a short question.
No, that's great. And actually that leads us into the next question about, what are some of those unique challenges that CASA volunteers face. How does CASA support them?
Sure. Well, right now we have a system that's undergoing a transformation, right? It's going from a state system to a privatized system. What's happening during the course of this transformation is a lot of turnover in parts of the state that are still state operated, and in where the private providers have taken over, there's still a lot of turnover. So the CASA volunteer is the individual that ends up filling the gap because they are the ones that know the child, so that when that caseworker turnover is happening at a high rate, it's that CASA volunteer who knows the child, who's able to give the information to the court, who's able to give the information to that new caseworker that's assigned, looking out for the child's best interest as this turnover is happening all around them. CASA is the constant. They're the constant connector to that child, to everyone involved in that child's case.
Earlier, you talked about the 254 counties across Texas, and then we have all the regions, right, across Texas. So how do you facilitate collaboration and best practice sharing among those regional offices?
Sure. Let me start by saying we all know Texas is a big state, right? And with 254 counties, and every county is different, right? And even within counties, you'll have an urban area and a rural area, and nothing could be more different. And so there's a lot of difference there that we work on. And so the primary thing that we do is keep everybody focused on the mission. Positive volunteer advocacy for children in care, so that we're looking for the best outcomes for these children. We keep people focused on that. And then we have a number of events that are set up to allow programs to communicate with each other, both in person and virtual. We have monthly meetings of urban, rural, and suburban programs so that they're talking like size, because like size has like issues, no matter where they are in the state. And then we have our quarterly meetings of executive directors and program directors, and that's virtual. And then we have an annual meeting of program directors. We had just a number of meetings, a number of places and ways for programs to exchange information. We also have standards. CASA programs operate in accordance to standards. And so we have our quality assurance team that's going to all the programs to making sure they're operating in accordance to standards, which includes state law. So they're looking at that to make sure that's happening. And where they see best practices, those quality assurance specialists are communicating those best practices to other programs around the state as well. So we create lots of opportunities for programs to share information, and then we, as Texas CASA staff, are taking that information to the regions as well.
Okay.
And to the programs.
Well, that's wonderful. So in your experience, what has been the most impactful policy or even initiative implemented by Texas CASA that has significantly improved advocacy for foster children? If you had to pick one.
Yeah, if I had to pick one, it would be our Collaborative Family Engagement Initiative, because that is focused on a trauma-informed approach, another big initiative, but a trauma-informed approach to reunify children or keep children connected with their family. Ideally, reunification happens, but if it doesn't, there's still someone in that child's family line who's going to be brought in to support that child. And then other individuals like teachers. I've had children who have teachers who've been more impactful to them than some family members. And when that teacher finds out the child's in the welfare system, that teacher says, well, I want to take, I'll say Johnny for the lack of a better name, I'll take Johnny home. And then Johnny goes to live with that teacher, and they create that bond, and then the teacher adopts, and then life goes on positively for Johnny. But that whole system, that whole, I'm going to call it that whole community of support that surrounds the child ensures better outcomes for children in care. We're really thrilled. It's, a decade plus now of collaborative family engagement in Texas that Texas CASA initiated and developed. And we do that in collaboration with the Department of Family and Protective Services. I'll say that. So not only were we training their staff, we're now training these privatized providers that are coming in and taking over the role of the state in terms of handling these cases.
Talked about the CFE. Let's get more into the training and development. And maybe there's a great CFE training and development sessions, or what other programs do y'all provide to enhance the skills of CASA volunteers?
So just at the start, we have pre-service trainings. That's 30 hours. So again, you don't walk in a door and get assigned a case. You walk in the door, you interview. And then if you make that interview, then you're attending classes, a 30-hour pre-service where you talk about the child welfare system, mental health issues, substance abuse issues. You're learning about all those issues that are impacting these families. Then again, sworn in. Other trainings would be collaborative family engagement, trauma-based relational intervention, so like a trauma-focused support for working with children who come from these hard places, teaching people how to do that, working with the many different kinds of families that are out there and the many different kinds of children that are out there. All that training is provided. And then there's 12 hours a year that volunteers go through to keep up with their training, to keep up with what's happening around them. And volunteers will tell you every time they get a case, that case is different. One child may need significant medical advocacy. So they're going to bone up on medical advocacy so they can best represent that child and fight for that child's interests. Other one might tell you that they have some mental health issues that they can't quite define. So they're reading up on mental health issues and how do I even find the right therapist to deal with what's presenting with this child. Advocates have the structured training, and then they have that training that they're going to do themselves to best advocate for the interest of the child in the cases that they're representing.
So what strategies employed by Texas CASA are there to ensure consistency and quality of advocacy across diverse regions with different needs?
Again, big state, right? So we start with the standards because everybody has the same standards. All the CASA programs have the standards. They're monitored to make sure that they're operating in accordance to standards. So that's that consistency aspect there. And then meetings. Well, there are regional meetings. Texas CASA has divided the state into 6 regions. And each region elects one of the executive directors from a CASA program in their region to represent that region. So that region will have regional meetings. And then that regional person that's representing that region has a seat on our board of directors. So they bring the needs of their region to our board of directors meeting. And then we also have separate meetings with the regional directors monthly. So we're getting this information constantly. Then we're constantly interfacing with programs, again, through our quarterly EDPD meetings. We're interfacing with board members with our quarterly trainings for board members. We have the monthly, we call them in-office hours, where it's virtual. So anybody from any program staff or director from any part of the state who wants to just talk to Texas CASA leadership can just Zoom in for one of those office hour Tuesdays and have that conversation, and that's once a month. And then again, lots of other trainings, on-site, virtual. So there are a lot of ways that we keep that consistency and that quality up and work to motivate programs, because it is not easy for the volunteer. It's not easy. It is not easy for the staff. It's not easy for the executive director. In fact, if we look at this going in the opposite direction, if you start with the executive director of a local program, they're balancing staff who are working with volunteers. Then you work with the program directors who are working directly with the volunteers, and they're working with the angst, the tension, the joys, the ups, the downs, the hair-pulling moments, and the exciting moments that volunteers experience. And those exciting moments are awesome. But those stress-filled moments where there's something that's happening that is just devastating to the volunteer, it's devastating to the supervisor as well. However, the supervisor has to be able to coach that volunteer through that moment so they can stay present, they can stay grounded, and continue to bring them their best self to that case. There's a lot. There's a lot there.
It sounds like it.
Yeah.
You would have to have self-care, right? And
yes.
So is that emphasized also?
Yes.
Because I know our direct client is the child.
Right.
But you're right. Like, you can't do that if you don't take care of yourself,
exactly.
too. So is that something that you all advocate for or provide additional training for or emphasize?
We emphasize it as Texas CASA. We're not really working with the volunteers directly unless we're at one of our conferences, right? So with the staff of local programs, we're emphasizing that because we don't want them to lose sight. We don't want them to become so jaded that they are unable to respond appropriately.
And that quote of "it takes a village," right?
Yep.
to be with the child and that consistency, the consistent that you said. Now think about that volunteer that may have never had kids of their own.
That's right.
But feel it in their heart and go through the training you just described, and then the trauma informed, right? And for them to stay on a case maybe a year or 2 years even, and provide that support. So yeah, I mean, really having that support at that top level, as you're talking about, can really change that experience for that child.
Absolutely.
Yeah.
Absolutely. And the other part of that too is children are moved. It's not like you come into care and they put you in a place and you know you're going to be there. Your child is situated. Sometimes it's an emergency shelter. So now that you have whatever was happening at home, you have that trauma. Then you have the trauma of removal. Then you have the trauma of being in a place where you don't know anybody. It's an emergency shelter. And then you get moved from there into a foster home. And then you get moved from there, for whatever reason, to another foster home. And then as you're settling in, you might get moved. You come home from school and you're going to another foster home. And one of the things we know is that with every move, if a child is moving schools, they're losing 6 to 9 months of education. So whatever they learned is like lost, because for 6 to 9 months, their brain is still transitioning from point A to point B and all the newness in point B before they can actually focus on being in school. So now that they're focused, they've already lost 6 to 9 months. Now they have to catch up again. The volunteer permanency, that one person that's consistent with that child, makes the world of difference for the child, which is why we have to systemically, and I say systemically within the CASA network, support volunteers to be able to do the best that they can do and take care of themselves so they can be their best self with that child.
If you're finding value in today's conversation, don't forget to subscribe to EduVoices, championing foster futures on your favorite podcast platform. Subscribing ensures you never miss an episode packed with powerful stories, expert insights, and actionable strategies for supporting children in foster care. Plus, it helps us continue growing this community of educators, advocates, and changemakers. Now let's get back to the conversation.
Texas CASA is in the backyard of the state capitol. So I think this is the most important question, because if change is going to happen, we've got to go through legislation. So how does Texas CASA engage with state legislators and policymakers to influence policies and foster care regulations?
Big question. So public policy advocacy is a big part of what we do here at Texas CASA. And we do that in a number of ways. One, we have what we call legislative advocacy teams, which is we work with the 74 programs with individuals within those programs who are interested in the legislative process. We'll train those individuals on how do you engage with your legislature. We'll give them the resources they need to take, like what is the data for your region that your legislature will want to know because you're in that legislator's district. And so we give them that information, and they talk to their local state elected officials about what is happening in child welfare and what is CASA's role and what is that local CASA program seeing. So they're having that, we call them LATs, legislative advocacy teams. So you know what they say, all politics is local. So we start local, right? Start local. And then we'll have that unified message that programs are sharing across the state. And our role at Texas CASA is to put a bow on what they're saying to their local elected officials, so that when they come to Austin, the state elected official already understands the issue as it impacts their district. And our job is to give them the big picture. Like, what does that look like then across the state? So we do that. And then when we advocate, we're not only advocating for children in the child welfare system, we're advocating for children and families generally, because the whole goal is you don't want children and family in any system, right? You want them healthy. So if we can support prevention initiatives, we're doing that because we'd like to see community-based services that actually address the needs of families who are in crisis, that might keep them from going into crisis, right? So we're going to support all that. If a child has a mental health issue, a behavioral health issue, there's substance abuse in the family, we're going to pay attention to all that legislation, because any one of those tracks can lead a child into the child welfare system. We also monitor and keep an eye on, and sometimes when it's more in our lane, we'll step in to support legislation dealing with the juvenile justice system. Many of the kids in the child welfare system, many of them at some point will have contact with the juvenile justice system. So we want to make sure that there's a wholesomeness there too, right? That what's happening policy-wise there is paid attention to. That's the big picture. As it relates to specifically the CASA arena, we actually ask our members, we ask the program directors, the local program staff, and we ask them to ask their volunteers, what are the issues that you want Texas CASA to pay attention to? And so we'll collect that from all the programs across the state, and everybody connected with those programs across the state, and then we'll put those into policy buckets. And then we'll take those buckets to our board of directors who will, if you will, bless the bucket. And then we keep an eye on legislation targeting those buckets during the course of a legislative session. And then post-session, of course, we're out and around the state to all the regions, meeting with programs to talk about what passed that's going to impact what they do as a CASA volunteer or as a CASA program.
Mm-hmm. I like how you said y'all support the whole, right? The whole child. And I mean that by not every case has a CASA. Is that correct?
That's correct.
And so I'm really glad you said that, because that's very important. Even though y'all may not be dealing with a particular case that has a CASA on it, you can still advocate for that child.
Exactly.
And that's very important.
Exactly. We have about 10,000 children in care who do not have a CASA volunteer. And so one of the things we are constantly focused on is we have a recruitment campaign that's a statewide campaign. And we also use it to align with local program volunteer recruitment campaigns, right? Because the goal is to get the message out there. Post-COVID, volunteerism took a dive nationally. And every time it starts to come up, something happens with the economy and people pull back in. And so it's a constant effort to really keep the CASA message and mission in front of people. Because our goal, our dream is every child in care has a CASA volunteer.
So just for context, I don't have any experience with foster care children other than those that I worked with in the school. So my background's in school psychology, but through this work, it's really opened my eyes to some of these issues that I had no idea about. And so at this point, I feel like my role is largely to ask the questions that other people may not know about. And so that does lead me to another question of, is that really one of the biggest barriers to addressing the needs of those 10,000 children who don't have a CASA? Is the lack of volunteers? Are there any other issues that may contribute to somebody or a child not having a CASA?
That's the big issue.
Okay.
We need the volunteers. We need to be able to have those people come to our site. If you want to become a CASA volunteer, is becomeacasa.org. You go to that site online, put in your information, and it'll direct you to the CASA program in your area so that you can directly communicate, because they will be able to directly communicate with you and you with them at that point to volunteer, or at least explore the volunteer options. And one of the things that we do in CASA programs do as well, if somebody shows up and their heart is children, but it's not so much advocacy, it's more of foster care. They're going to direct them to the resources on how to become a foster parent in that area. We, as CASA and the CASA network, we're looking, we really want our volunteers, right? First and foremost, but we really want people who can make that qualitative difference in the life of children enter the system to be available wherever is the best place for them in the system, mm-hmm. right? And the other thing I want to say, too, is because if I was somebody who was thinking about being a CASA, but thinking, oh, God, I don't know if I have the time for this because I have like this amount of time, but I don't have that amount of time, people can partner. You can be a CASA volunteer with your best friend or with your spouse or with your partner. Or you can partner. So you don't have to do it all yourself. You would both go through the training. You would both go through the screening. You would both go through all that. You would both be sworn in. But you let everybody know whatever we're assigned to, we want to do it as the two of us. So that's something else that people should know or want to know or might not even know to ask.
Right. So Dr. Palmer, that's what you were talking about with your wife. You two partner together and you take on a case together.
Absolutely.
Okay. Interesting.
Yeah.
All right, so then that brings us to our next question then. Can you discuss a major challenge that Texas CASA has faced recently, and how was that addressed?
We're still facing that challenge.
Okay.
And that's that whole challenge again of that system transformation from state operated to privately operated. And it's privately operated, it's a different operator in each region, which means, and some of our because the state has now divided their regions into, I think, 11, we have 6. So some of our programs are dealing with 3 private providers who are not connected. They're all different entities who have different ways of doing things. And others, the majority of programs are dealing with 1, thankfully. That's a challenge, right? Just the whole transformation is a challenge. And then when you have programs who are dealing with 3 or 2 of these private providers, that's its own challenge. But the constant challenge is about communication, because a lot of the providers hit the ground, and they hit the ground running because they're now responsible for these cases and these children and their placements, et cetera. So they're running, but again, their staff is turning over. And so, like, who talks to who when, who knows who to talk to, and who knows what whose role is. And so a lot of times, again, it's the CASA volunteers or the CASA staff, like educating these private provider staff as to, this is who we are, this is what we do, this is what you're supposed to be doing. Did you know you're supposed to be over here? I mean, those are the kind of conversations that the volunteers and the staff are having with these private providers. So the challenge is, one, we're looking forward to the day when this whole transformation is stabilized. But in the meantime, it's the communication and the collaboration that has to happen in order for this transformation to be successful. And success is positive outcomes for children in care.
Absolutely.
And right now we're seeing some places where adoptions are being held up, or there are multiple moves, or children are being placed. I mean, I think the last record I read from Child Protective Services, it was a report, 3 out of 10 remain in county. So that means 7 out of 10 are out of county, which means our volunteers, local program volunteers, are traveling all over the place to visit their children to make sure they're able to maintain that contact and keep that child feeling connected. Because the further away they are, the more disconnected and unfamiliar, the more unfamiliar things are, the more disconnected they feel.
Looking forward, what are the key goals and priorities for Texas CASA in the coming years?
To keep our eye on our mission, volunteer advocacy. We don't want to dilute that. We want as many children, we want 100% of children in care to have a CASA volunteer, so we have to maintain that focus. And within that focus, we have to be able to adjust to whatever the needs are that are arising as the system transforms, right? So that's a big one. The other is to maintain our volunteer recruitment campaign, because we're always going to need volunteers. And we really look forward to the pre-COVID level of volunteerism coming back. But until then, we have to massage, nudge, do whatever we can, keep the word out there and let people know what's happening. Because Texans have good hearts. And I think when people find out who's in the foster care system, 50% of the kids are under the age, I think it's 54% actually, are under the age of 5. They're 5 and under. So we're talking, so if you're afraid to deal with a teenager, there are children, there are babies, there are toddlers. If you love teenagers and not really crazy about the youngers, we've got tons of teens. So there is somebody there who needs that Texas citizen. So we have to just keep that message out there so people understand that. So the other piece is keeping up with the volunteer recruitment campaign. And then we want to maintain and continue to build on the collaborative efforts that we have with these providers to strengthen their presence, to help them strengthen their presence, to strengthen the communications that's happening with local programs. Because at the end of the day, we want a system that works for Texas children.
What can you tell our listeners? Again, you mentioned it before. If they feel it in their heart today listening to this, can you tell us again, how do they get involved to help a child?
Absolutely. My pleasure to do that. Go to becomeacasa.org. That's becomeacasa, all one word, .org. And it'll take you, you'll put in your information, it'll direct you to where the CASA program closest to you. And for example, if you're in Lubbock, but you work in Midland during the week, and so you'd rather volunteer in Midland, you can put that information in. It'll direct you to the Midland program and connect you to them. So you put in where you want to volunteer. It'll connect you to the right program.
Awesome. Vicki, thank you for your leadership. Thank you for sharing your insights with us today. Thank you for allowing us here in your facility. We have an exciting rest of the day with some other colleagues of yours. So thank you again.
And thank you for joining us for this episode of EduVoices. We hope this conversation gave you a deeper understanding of how statewide leadership shapes advocacy for foster-connected youth. Until next time, thank you for listening, thank you for caring, and thank you for championing foster futures.
Thank you for joining us on EduVoices, Champion Foster Futures. We hope today's episode sparked new insights and deepened your commitment to supporting foster youth. For updates, bonus content, and upcoming sessions, follow us on our social media outlets or visit our podcast page. But until next time, keep listening, keep learning, and keep advocating.